Hi, my name is Dr. Bob Moulas. Welcome to my clinic here in Orange, California. And today's subject is instrument adjusting. Everyone that goes to a chiropractor is familiar with the traditional hands-on adjusting where the chiropractor pushes or pulls with his hands. Today what I'd like to do is show a couple of different instruments that we use in our clinic. And the first one here is it's a mechanical apparatus. It's called the activator. And the second instrument that we use in our clinic is called an impulse. This is actually electrical. And we do use these instruments on about 90% of our patients. First thing I'd like to stress, though, is the safety factor on regular hands-on adjusting. Regular adjusting is safe. Instrument adjusting is just another way to go. And first thing I'd like to do is go over the advantages of instrument adjusting. And the first one is that it puts a lot less stress on the patient and the doctor. That's always a big thing. And we're also able to adjust patients that have osteoporosis, which is thinning of the bones. And we're also able to adjust post-surgical patients. What's really great about instrument adjusting is how specific the actual instrument can be. This little rubber tip is so specific compared to actually putting a hand on someone. And also we're able to do different settings for the neck, the mid-back, and the low back, so we can dial in the same strength every time. And the thrust is so much faster than the body's reflexes. This way the body can't tighten up when you're trying to do an adjustment. This happens occasionally when you're adjusting a patient. They'll tighten up and then you have to regroup and go back and try to get the adjustment again. Another item that's great is there's no popping or cracking sounds when we do the adjustments. Patients love that. And if I go on vacation, or if your doctor goes on vacation, you can get the same adjustment from whoever doctor that comes into the clinic. What I'd like to do now is put this theory to test, and we're going to actually do an instrument adjustment. Hey Trey, how you doing?
Good, how are you?
Good. What's bothering you today?
I'm having some pain in my lower back.
Okay. Is it constant?
Yeah.
Was a scale of 1 to 10, how do you rate it?
I'd say about a 5.
About a 5?
Yeah.
And how are you doing with the neck?
I'm having some pain back here.
Left side? Okay.
Yeah.
Constant again?
Yeah.
Okay. What do you rate it?
I'd say about a 5 too.
About a 5. So
yeah.
about a 5. How long has this been going on?
A couple months.
Okay, about 2 months. Okay, Trey's a patient here at my clinic. We haven't seen him in a couple of months. He's got some low back pain and some neck pain. So let's just stretch out here face down on the table. Okay. And Trey's got a little bit of a short leg over here. This hip is off over on this side. So we're going to take our impulse here and relax the muscle first. The neck. How's that feel, Trey?
Feels good.
Okay. Well, there you have it. One fixed low back and one fixed neck. Thank you for viewing my video. Till next time.